Hello and namaste. My name is Dr. Vidya Prakash. I am an infectious diseases physician in the United States, and I'm going to answer some questions about COVID-19. If you or a loved one is diagnosed with COVID-19, please be sure to get plenty of rest, drink plenty of fluids, and eat nutritious food. For fever, you can take paracetamol or acetaminophen. Do not exceed more than 4 grams of acetaminophen in a 24-hour period. Check your oxygen saturations using this device called a pulse oximeter 3 to 4 times a day. If your oxygen level is less than 92%, you must consult with your doctor and seek medical care immediately. In addition, if you begin to notice trouble breathing, confusion, or chest pain, go to your nearest health facility. If you are caring for a sick person in the home, if possible, have the sick person stay in one room or physically away from other people in the household. Keep them at least 1 meter or an arm's length away from others. Have the sick person wear a mask or a cloth face covering when they are around other people, including family members. Wash your hands often with soap and water for at least 20 seconds before and after caring for the sick person, before preparing and eating food, before and after wearing gloves, and after using the toilet. When coughing or sneezing, cover your mouth and nose with flexed elbow like this, or use a disposable tissue and discard immediately after use. Monitor everyone's health in the home to detect symptoms such as fever, cough, and trouble breathing, and if detected, call your healthcare facility immediately. It is a good idea to try self-proning at home. You will need 4 to 5 pillows, and this requires regular alterations in lying positions. You start with 30 minutes as shown in the picture, lying on your belly. After 30 minutes, you switch to lying on your right side. After another 30 minutes, you switch to sitting upright. After another 30 minutes, you lie on your left side. And finally, after those 30 minutes, you go back to lying on your belly. It's important to avoid proning for at least 1 hour after meals, to maintain proning for only as much time as easily tolerable. You may prone for up to 16 hours a day in multiple cycles as you feel comfortable. Pillows may be adjusted slightly to alter pressure areas and for comfort, and keep track of any pressure sores or injuries, especially around bony areas. If you have had COVID-19, you can still get the vaccination, but you must wait until you are out of quarantine, which is 10 days after your symptoms started, and no fever or any other symptoms for at least 48 hours. If you were treated with a monoclonal antibody, which includes the following drugs: bamlanivimab, sacirivimab, etesivimab, and imdevimab, wait for at least 90 days after your symptoms have resolved to get the vaccine. Thank you so much. I hope you feel better soon.